Okay, so hello everyone. My name is Joko Desira dari Pemayun. With the last 3 digits of my student number is 165, and I will explain to you about the background of our student project. So dengue is an arboviral disease that happened because of the dengue virus, and there are several types of dengue diseases itself, from the moderate type of dengue, which is dengue fever, and the fatal or severe type of dengue disease, which is dengue hemorrhagic fever or DHF. NS1 is a non-structural glycoprotein produced by all types of flaviviruses, and this glycoprotein plays a role in virus replication and viability. Currently, an examination for NS1 test has been developed, and it can detect dengue infection from the first day of fevers, because some researchers has also found that the existence of NS1 in people with dengue fever or dengue hemorrhagic fever. These are the problems formulations for our student projects. First is what is dengue hemorrhagic fever. Second, what are the treatments and prognosis of dengue hemorrhagic fever? Third, what are the questions formula of dengue hemorrhagic fever using PICO? Fourth, what are the journals that can be found to answer the clinical research questions? And lastly, what is the critical appraisal of dengue hemorrhagic fever? Next is the objectives. It's to know what is dengue hemorrhagic fever, to know the treatment and prognosis of dengue hemorrhagic fever, to be able to make a question formula of dengue hemorrhagic fever using PICO, to be able to answer the clinical research question based on journals, and to know the critical appraisal of dengue hemorrhagic fever. And last but not least is the benefits of our student project is as a medium to develop skills and knowledge in searching for sources and information and conducting critical reviews of diagnostic studies, and also as a medium of information in conducting critical reviews of diagnostic studies. So that's all from me. Next will be continued by my friend for the second chapter. Thank you.
Hello, my name is Rajasthan with my last training digit number 164. So I'm going to continue the presentation about the definition of dengue hemorrhagic fever. Dengue fever is caused by dengue virus, such as dengue 1, 2, 3, and 4, that is transmitted by Aedes mosquitoes, primarily Aedes aegypti. The clinical manifestations start asymptomatically to mild flu-like symptoms. Dengue fever is identified with sudden onset of high fever with 3 until 14 days after the bite. Some cases progress to severe form, namely dengue hemorrhagic fever and dengue shock syndrome. Dengue hemorrhagic fever can be suspected with 2 of the following 4 clinical manifestations, such as sudden onset of fever lasting 2 until 7 days, spontaneous hemorrhagic manifestation, hepatomegaly, and circulatory failure with additional criteria of thrombocytopenia and increase of hematocrit more than 20%. Dengue virus found in over 100 countries across Asia, America, Middle East, and Africa with 50 to 100 million infections annually. Maybe that's all from me. Next will be continued by my friends. Thank you.
Hello, my name is William Asana Hersanso with the last digit number of 011, and I would like to express about the pathophysiology of dengue hemorrhagic fever. Once inside the human body, the dengue virus targets the immune system such as monocytes, macrophages, and dendritic cells. The virus enters these cells and begins to replicate, leading to release of viral particles and the activations of immune responses. This initial phase of viral replication and immune activation triggers the release of signaling molecules called cytokines and chemokines, which lead to the recruitment of additional immune cells to the site of infections. As the infection progresses, the dengue virus triggers a complex interplay of immune responses that can lead to the development of dengue hemorrhagic fever. These events include increased vascular permeability, coagulopathy, and plasma leakage, which can lead to potentially life-threatening complications. One of the hallmarks of dengue hemorrhagic fever is plasma leakage, which occurs as a result of increased vascular permeability.
My name is Winnie Chandra with the last 3 digits of student number 027. I'm going to talk about the diagnosis of dengue hemorrhagic fever. Laboratory confirmation is necessary for a definitive diagnosis of dengue infection. Traditionally, the diagnosis of dengue can be made by the molecular polymerase chain reaction or PCR, immunological-based testing or virus isolation, and also ELISA. Nevertheless, these methods are expensive, time-consuming, and need certain tools and expertise. Commercial dengue rapid diagnosis tests have been developed recently to identify IgM and IgG antibodies to the dengue virus, as well as the dengue NS1 antigen from whole blood, serum, or plasma. The results can be achieved in less than 30 minutes. In both primary and secondary dengue-infected patients, NS1 is present from day 1 to day 9 following the onset of fever. IgG appears by day 14 and lasts for life. IgM is detectable from days 3 to 5 of sickness and can last for up to 3 months. Consequently, from the acute to the convalescent stages of dengue infection, preliminary dengue diagnosis can be made using the simultaneous testing of NS1, IgM, and IgG on a single cassette.
Thank you for the chance. My name is Seroprevalence with the last 3 digit of study number 119. Today I will explain about the treatment of dengue hemorrhagic fever. So managements are done based on clinical manifestation, and it can be divided into 3 groups: Group A, Group B, and Group C. Group A is a patient who managed at home. It is managed with symptomatic treatments and adequate oral fluids. And the next is group B, which is in hospital management. Its initial treatment is IV crystalloids, and group C is emergency management with colloid and blood transfusion. That's from me. The presentation will be continued by my friend. Thank you.
Hi everyone, my name is Yaninta Ayu Ardiantinipari and my last 3-digit student number is 159. And now I'll explain about the prognosis of dengue hemorrhagic fever or DHF. So a dengue fever is a virus that is spread by mosquitoes, and dengue hemorrhagic fever or DHF is a severe version of the illness. A more severe version of the illness involving bleeding, plasma leakage, and organ dysfunction is associated with DHF. So the prognosis for dengue shock syndrome and dengue hemorrhagic fever is dependent on the early detection and treatment of the shock or avoidance. It's vital to remember that dengue hemorrhagic fever may be fatal. So if someone is suspected of having the illness, they should visit the doctor right once, especially if their symptoms get worse or if they exhibit any warning signs of severe dengue. After shock sets in, the mortality rate might reach to 12% to 44%. However, less than 1% of patients can die in facilities that provide enough intensive supportive care. There's no antiviral medication, and intravenous fluids are given as a conventional therapy to increase the plasma volume. After receiving timely and sufficient fluid and electrosupportive care, most patients can recover. So that's all from me. Thank you.
Greetings, doctors and friends. My name is Zaki, last digit of SHU number 122. So today I will explain about the question formulation using PICO from the scenario. So according to the scenario, we can elaborate that the population is dengue and dengue hemorrhagic fever. The intervention is PCR rapid diagnosis test and S1 with IgM and IgG captured ELISA as the comparator. The desirable outcome is the accuracy of dengue or dengue hemorrhagic fever diagnosis. From this, we can formulate a clinical question such as, does an S1 test have a higher accuracy compared to RDT captured ELISA for dengue or dengue hemorrhagic fever diagnosis? Maybe that's all from me. Thank you.
Greetings, my name is Theodore Mansinababan with Greetings, my name is Theodore Mansinababan with relay digit number 093, and I'll explain you about our journal research. We found about 218 articles that fit our search. We used PubMed Advanced Search Engine, and after we filtered out, it filtered into 209. And after the critical appraisal, we managed to find one article that suits our descriptions, then that have a strong validity, importance, and acceptability. So this is our documentations for PubMed Advanced Search Engine. We use the keyword dengue fever, dengue hemorrhagic fever, diagnosis, and children. We filters using 5 years ago, and and the second filters we use our full text filter. From 218 journal articles we found on PubMed, in PubMed, there are 9 journals that was not a full article. From 209 journal articles we found on PubMed, after our critical appraisal, we found the best journal article that is suitable for our further critical appraisal. It named Seroprevalence and Incidence of Primary Dengue Infections and its correlations in Fetomaternal Prognosis in Western Rajasthan. So that's from me. Thank you. Next.
Greetings, my name is Vida Aditi Sudana with the last 3 digits of student number 108, and I'll be explaining about the validity aspect. This research took place at a tertiary care hospital in India over the course of January 2021 to December 2021, involving patients screened for dengue fever. The total sample size was determined using proportional photo sampling, encompassing all patients tested for dengue fever at this hospital during the study period. All the 1,664 patients underwent screening with the dengue duo rapid CAR test, which is the NS1-AG and or IgM or IgG antibody, with a positive rate of 53.90%. And from these positive cases, 250 patients were selected for retesting using IgM capsule ELISA with a seropositivity of 34%, which is 85 cases out of 250. And 42% of these cases were in pediatric age group, in which it is 0 until 10 years, and 32.4% were in the 11 until 20 years age range. And there is some possible bias in this study. in which this study only represented patients seeking treatment at tertiary care hospital rather than the broader infected population. And also, the sampling method employed in this study may also lead to selection bias. Okay, that is all from me. The next one will be continued by my friend. Thank you.
Hello everyone, my name is Yusufina Taji with class 3-digit student ID number 087, and I will going to explain about the point 2.5.3 importance. The study conducted on 60-64 dengue cases highlights a notable 53.90% positivity rate using the dengue rapid cut test. The research delves into demographic factors, emphasizing a higher incidence among the pediatric population. It's 42% in 10 years. Seasonal patterns, clinical manifestation, and thrombocytopenia prevalence, 30.40% cases are also explored. Evaluation of diagnostic tools, particularly dengue draw cards versus IgM ELISA, reveals varying performance. Gender disparities are noted, with 56.80% cases in males. The research underscores the importance of understanding the dengue dual cards accuracy compared to IgM ELISA, offering insight crucial for healthcare practitioners. Specificity and sensitivity figures provide nuanced perspective on the rapid diagnosis test strength and limitation in the regional context. Overall, the study enhanced our comprehension of dengue in Western Rajasthan, offering practical application for public health planning and clinical decision-making. That's all from me. Thank you.
Greetings for everyone. My name is Fetomaternal, and my study is the presentation regarding the applicability and to somehow answer the clinical questions of this how just NS1 has the greater accuracy compared to RDT capture analysis. The study itself visualizes the comparison of other RDT such as NS1, GM, and IgG with McAllister as a reference, and it shows the maximum sensitivity was seen by NS1 antigen. Speaking about applicability, there are some questions that needed to be answered to evaluate the applicability. And the first one is the patient characteristic, which is seen by the similarity between this patient in our fields and the study subject. And the second one is patient preference or concerns. In the scenario given before, there's no specifications for preference consideration. But generally, there are some specific consideration in selecting the diagnosis test, which is further called as a shared separation is explained further in the box on the right. And the other aspect of evaluability is the risk of benefit and harm. The test itself is considered to be quick and easy to use, and some studies also state that it is considered to be cost effective. By doing detection or diagnosis, it may shorten the illness That's all for me.
Okay, thank you for the opportunity. I would like to continue with the conclusion of our student project, where the first and foremost, early diagnosis is important to reduce mortality rates in patients regardless of age, regardless if it's pediatric patients or elderly patients in the case of dengue. Secondly, each diagnostic marker, whatever they may be, either it is NS1, IgG, IgM, they all have different sensitivities and specificities. Therefore, each function can be different and variative among researchers. Last and not least, ELISA kit is adequate to confirm early suspicion of diagnosis of dengue. That is all from me. Thank you for your attention.